Palindromic rheumatism. By introduction, a definition, palindromic rheumatism (PR) is a rare inflammatory condition, characterized by recurrent, self-limiting episodes of joint inflammation. B. Prevalence. Although uncommon, PR is recognized as a distinct entity in the spectrum of rheumatic diseases. 2. Diagnosis criteria, a clinical criteria. 1. Recurrent, sudden onset episodes of arthritis involving one or multiple joints. 2. Complete resolution of joint symptoms between episodes. 3. Short duration of each episode, typically lasting hours to a few days. B. Laboratory criteria. 1. Elevated acute phase reactants, for example, erythrocyte sedimentation rate ESR, C-reactive protein CRP during active episodes. 2. Absence of rheumatoid factor and anticyclic citrullinated peptide antibodies. C. Imaging criteria. 1. Radiographs may show no or minimal joint damage during and between episodes. 2. Ultrasound or MRI may reveal synovial inflammation during active episodes. 3. Clinical presentation. A. Joint involvement. 1. Predominantly involves the small joints, such as those in the hands and feet. 2. Migratory pattern, different joints affected in different episodes. B. Extra-articular manifestation. 1. Systemic symptoms like fatigue and malaise. 2. Some cases may have associated tenosynovitis. C. Differentialdegens. 1. Distinguishing PR from rheumatoid arthritis RA and other inflammatory arthritides is crucial. 2. Clinical and serological differences aid in diagnosis. IV management, a acute episode management. 1. Non-steroidal anti-inflammatory drugs and SAIDs for symptomatic relief during episodes. 2. Short courses of low-dose corticosteroids may be considered. B. Disease-modifying antirheumatic drugs DMARDs. 1. Methotrexate is often the first-line DMARD for long-term management. 2. Hydroxychloroquine may be considered, especially if there are contraindications to methotrexate. C. Monitoring and follow-up. 1. Regular assessments to evaluate disease activity and adjust treatment as needed. 2. Monitoring for progression to more definitive rheumatic diseases, such as rheumatoid arthritis. D. Patient education. 1. Educate patients about the episodic nature of the disease and the importance of early intervention during flares. 2. Emphasize lifestyle modifications and joint protection strategies. V. Prognosis, a variable. PR has a heterogeneous course, with some patients experiencing spontaneous remission, while others may progress to more established rheumatic diseases. B. Regular follow-up. Long-term monitoring is crucial to detect any evolving rheumatic conditions. VI. Conclusion. Palindromic rheumatism presents a unique challenge in diagnosis and management due to its unpredictable nature. A multidisciplinary approach involving rheumatologists, primary care physicians, and patient education is essential for optimal outcomes.